Hi. So today I'm going to share 3 interesting things about diabetes and then of course the relationship to heart disease. Number 1, India unfortunately is the diabetic capital of the world, meaning as South Asians, Indians in particular, we are more predisposed to diabetes genetically. Number 2, the targets for risk factor control when you have diabetes are the exact same as when you have coronary artery disease. Why? Because diabetes is such a bad actor. So when you look at your cholesterol level targets, when you look at your blood pressure targets, etc., we almost want to keep all these other risk factors under control as stringently when you have diabetes as when you have coronary artery disease. The other interesting thing is that with type 2 diabetes, which is the most prevalent type of diabetes, is almost entirely can be kept under check, or in some instances even reversed, when you really take good care of yourself and have a really good lifestyle. Of course, not everyone is going to have reversal or under optimal control. Some people might need medications. So you need to know, and this is an important tip. I've seen so many diabetics at this point who have heart disease who have no idea about how their blood sugar control is. They're like, yeah, I checked it this morning, it was like something. You need to know your hemoglobin A1C, which essentially gives you an idea about how well your blood sugars were under control over the last 3 months or so. And you want this number to be lower than 7, absolutely. And I mean, lower is better, but lower than 7 if you're a diabetic. Hypertension is often referred to as the silent killer. Why? Because many people don't have any idea that they're suffering from high blood pressure. It used to be, and I think a lot of people still refer to as essential hypertension when you have no attributable cause. And some people just think it's a normal part of aging. Now, here's the thing. Although you don't have symptoms, this can really accelerate. It can increase your risk of coronary artery disease. Also, it can increase your risk of kidney disease. It can increase your risk of strokes and a whole host of other things. Now, how do you know? Get it checked. When you go see your primary doctor or your cardiologist, have your blood pressure measured. You should obviously know your numbers. And how can you keep it under control? One of the big factors that play an important role in hypertension or high blood pressure is your lifestyle. So obviously there are things that cause you stress, anxiety, etc. Work on strategies to reduce these. Of course, diet always plays an important role. Increased salt intake and unhealthy foods can often put you at a higher risk for high blood pressure. Not sleeping enough can also put you at a higher risk for blood pressure because it does stress the system. Now, there are a lot of medications that can be taken to keep your blood pressure under check. Now, if lifestyle alone doesn't work, you might need additional medicines to keep your blood pressure under optimal control.